Are tummy tuck or abdominoplasty scars visible after surgery? This is the question on minds of many patients. They're considering getting a tummy tuck to get their bodies back, but they're worried about the scar. Some people have told them, why are you doing that? It'll be a very bad, ugly scar. Today, to break the myths and show you how tummy tuck scars can be natural, well hidden, I'm Dr. Aniketh Venkataram, a plastic surgeon at the Venkat Center for Aesthetic Health, Bangalore. So, at the outset, let me say that tummy tuck is a surgery that will always have a scar. There is no way to do this tummy tuck without a scar. But a well done tummy tuck will have such a scar that no one will be able to see it. To understand more, let us first understand what a tummy tuck is. A tummy tuck or an abdominoplasty, also called a mommy makeover, is a surgery done to restore a woman's body after multiple childbirths. There are few things that happen to a woman's body after repeated pregnancies. Number one, there is some extra stubborn fat, which is very hard to get rid of by gym, dieting, whatever. Number two, there is almost like a curtain of loose skin in the lower part of their abdomen. It's like one flap. This is because the abdomen stretched during pregnancy when the uterus expanded, but now that the uterus gone inside, all that skin hasn't contracted, there is some leftover skin. Particularly, it gets worse after multiple pregnancies. Number three, there is muscle weakness, what is called divarication recti. Everyone has a muscle in the center of their abdomen called a rectus muscle. During pregnancy, when the uterus stretches, this muscle, because it has to stretch, it stretches to the side. So you end up with a central area where there is no muscle, the rectus muscle comes to the side, and the central area is an area of weakness. So the abdomen bulges in this area. So you have extra fat, you have extra skin, and you have muscle weakness. A tummy tuck or an abdominoplasty helps to repair all three of these things. In this surgery, what we do is we first do liposuction to remove the extra fat. Then we put a cut in the lower part of the abdomen. This is where the scar comes in. So we put a cut in the lower part of the abdomen and we lift up the skin. After lifting up the skin, we lift it up all the way to the chest. Then we repair the muscles. So we take the muscles that have come to the side and we repair it back to the center. Then we pull down that extra skin. We make a new hole for the belly button, and the original belly button, we pop it out through that hole. Then we remove that extra skin and we stitch it. So at the end, you have one tiny scar around the belly button, one long scar in the lower part of the abdomen. These are the classical scars after an abdominoplasty. So now that you've understood what a tummy tuck is and how it is done, and you understood where the scars are, let's talk about how to make these scars as natural as possible. The trick is to make the lower scar as low as possible so that it comes within your underwear, your innerwear, your swimwear. And the second point is the belly button scar needs to be deep inside the belly button so that it is not seen on the outside. How you place the scars is the difference between a bad tummy tuck and a good tummy tuck. So firstly, the lower scar. I tell my patients this is going to be a scar that is longer than your C-section scar, but it's going to be lower than your C-section scar. We keep it very, very low. And this is where the surgeon's skill comes into place. One, it is important to do liposuction so that you're able to mobilize the skin really well and keep the scar as low as possible. Number two, it is important to use something called progressive tension sutures, which is what we do on the inside to move that scar down as low as possible. Number three, we always commit to a low scar. And sometimes we might add a small T-junction if we feel like there is any kind of tightness. This is preferable to having a high scar. So these are some ways that we can keep that scar very, very low. Secondly, coming to the belly button. Here, we use very advanced techniques to pin the belly button down to the tummy as much as possible. We do subtle sculpting and shading around the belly button so that it looks like it is invaginated inside. Because of all this, the belly button scar is deep inside the belly button, it is not outside on the skin. So this scar is also hardly visible. One more point about the belly button, sometimes we create a brand new belly button. When patients have an umbilical hernia, where there's a hernia coming through the belly button, that is something we fix during surgery. When there is an umbilical hernia, the umbilicus is very stretched out. You cannot use it properly. So we discard that umbilicus and create a new umbilicus. This is where we make small flaps in the skin and create a new belly button for the patient. So when all these steps are taken, you can have a very, very natural result. You can have a very low scar that comes inside your underwear. You can have a very natural looking belly button. And like I said, this is the difference between an average tummy tuck result and a great tummy tuck result. There are a lot of unqualified people doing tummy tucks nowadays. You have people who aren't trained in cosmetic surgery because they think it is just removing a big slab of skin. Well, technically, yes, but how you do it is what is important. When you don't pay attention to these finer aspects, you will technically have done a belly button, a tummy tuck. When you don't pay attention to these finer aspects, you will have quote unquote done a abdominoplasty, but it will look ugly. It will look flat. There will be a big scar around the umbilicus. There will be a big visible wide scar in the lower abdomen. The great surgeon is able to keep a very low scar, keep it very thin, and keep a very natural looking belly button. Let us see some patient results where I can show you the kind of results in scars that we are talking about. Now, apart from all this, at Venkat Center, there is something further different that we do in an abdominoplasty that you won't find in many other places. We use something called hybrid anesthesia. This is where we do the first part, the liposuction, under local anesthesia. And then we give general anesthesia for the skin removal and the muscle tightening part of it. Why do we do this? Because it increases the safety and the comfort. Safety, number one, we're making the liposuction very, very safe. We're avoiding the chance of any intra-abdominal perforation happening during liposuction by doing it under local anesthesia. Number two, by breaking it up this way, we're reducing the total amount of general anesthesia time. A tummy tuck normally takes around 5 to 6 hours. So instead of 5 to 6 hours of general anesthesia, you're having only 2 to 3 hours of general anesthesia. And this greatly reduces general anesthesia related complications, such as having blood clots in your legs, having fluid imbalances, needing to spend a day in the ICU, things like that. Number three, the local anesthesia we give keeps working for many hours after the surgery. So the patient is very, very comfortable after the surgery. You can view our other video on this hybrid anesthesia abdominoplasty here. So I hope this video helped you clarify some of your doubts. Scars in a tummy tuck are unavoidable, but when done well, they are imperceptible. All of my patients are extremely happy. This is a very gratifying surgery for me to do because ultimately it's a question of shape versus scar. Patients are getting rid of their horrible shape, really bad flabby skin, really weak muscles. No matter what they do, they gym and exercise, it does not go away. This is visible whether they wear clothes or not. The scars of the tummy tuck are visible only when there are no clothes. And even then, a lot of women have a C-section scar, so having this scar is no big deal. But the trade-off is you get an amazing result. You can have what is called a bikini bod. You can wear swimwear and your tummy will look toned and like it has come back to what it used to be. Here again, one final point I want to say is that oftentimes you see various celebrities, influencers, fitness people talk about how they got their body back with just diet and exercise. A lot of the times they are not being truthful. A lot of these people have had tummy tucks done to get back their body and they're playing it off as they did it with just diet and exercise. And this makes people feel bad. If you don't want to do this surgery, that is perfectly fine. But if you are doing the surgery and lying about it and telling people that this can be happen naturally when it cannot, then that gives people unrealistic expectations. For those who do want to get their body back, this surgery is an amazing way to do it. If you have any questions, do let us know in the comments. Do like, share and subscribe. Thank you.